My name is Dr. Ian Whittman. I'm the Chief of Emergency Medicine at NYU Langone Hospital, Brooklyn. I decided to become a doctor after some experiences in my youth. Unfortunately, when I was around 13 years old, my uncle died of AIDS. And during the last weeks and months of his life, I spent a lot of time in hospitals and hospice with him, and was just kind of in awe of the team that cared for him, their care for him, as well as their care for our family. I knew I wanted to be an emergency physician essentially the first time I walked into an emergency department. I love the fast-paced environment. I love the opportunity to see patients with a variety of different conditions, to have to know a little bit about a lot of different specialties and a lot about resuscitation. It's a high energy and fast-paced and very team-based environment, and all of those things appealed to me essentially from the minute I walked in. We see patients as they come in that are, in some cases, extremely ill and potentially near death, and minutes and in some cases seconds count. And so it's extremely important that the entire team work together. And when I say the entire team, people tend to think about doctors, they tend to think about nurses. There are hundreds of people that make the care happen all day, every day. Emergency medicine is in some ways sort of a symphony. It's important that we're all working together in lockstep to help the patient. We're really proud to serve an extremely diverse community. We serve an extremely diverse community socioeconomically as well as ethnically. New York City is a melting pot, and our emergency department is a beautiful embodiment of that. We recognize that when you come into our emergency department, you're coming to an environment that's potentially intimidating. You're coming on what could be the worst day of your life, or the worst day of your year, or the worst day of your week. But certainly you're not in the emergency department because you're feeling well. You're feeling unwell and you're seeking care. And we understand that. No one wants to be with us, but we want you to come to us when you need our help. My overarching philosophy when it comes to patient care ultimately is the grandma principle. What would you do if your grandmother was the patient in front of you? If you're not really sure how to proceed, if you're not sure what the right answer is, if you stop back and ask yourself, if this was your grandmother instead of someone else's father, mother, grandmother, what would you want for them? You usually end up in the right place. And I think it's a good guiding principle to sort of figure out what it is that you should be doing with your patients.